Once again, good evening, everyone. We will begin this session. Final announcement to the participants who have joined right now. I request the participants to keep their mics muted. And if you have enough bandwidth, you can turn on your videos. If not, please make sure your mics are muted for the participants. Save a life after life. A very pleasant evening to one and all gathered here. I would like to start by introducing myself. I'm Karis Divya, PG second year MSW CCP student and the coordinator of this event, along with my fellow coordinators, Chandana Books and Farnika Rastogi. We, Youth Voice for Life Even After Death Club, on behalf of the Department of Sociology and Social Work of Christ deemed to be University, welcome you all to this live session on Youth Steers Organ Donation hosted by Christ deemed to be University in association with Columbia Asia and Vikram Hospital, a unit of Manipal Hospitals, Bangalore.
Organ donation is defined as when a person allows an organ of theirs to be removed legally, either by consent while the donor is alive or after death with the assent of the next of the kin. About 50 lakh people in India die every year due to non-availability of organs. Data from 2015 show that as against the demand for 1.75 lakh of kidney transplants, there were only 5,000 transplants done. Similarly, of 50,000 people dying of end-stage liver disease, only 1,000 got their liver transplanted. Statistics are distressingly poor in case of transplantation of heart or lung. Transplant rates for cornea are 1 in 25,000 when compared with 1 in 199 and 1 in 14,000 for United States and Brazil respectively. The data is shocking and the rates are alarming. And it all comes down to us as budding social worker and fellow youngsters to be the change we want to see.
Youth Voice for Life, Even After Death, a service learning initiative of MSW students Christ deemed to be University, started in the year 2019 under the guidance of Assistant Professor of Social Work, Dr. Mary, aims to address the myths, misconceptions, and stigma towards organ donation through various awareness campaigns and activities. This year, in 2021, in continuation of our previous efforts, we have yet again gathered on World Organ Donation Day, and we are delighted to have Columbia Asia and Vikram Hospital, a unit of Manipal Hospitals, Bengaluru, to be with us to add more value to the program.
We are honored to have among us Dr. Victor Paul, HOD of the Department of Sociology, Social Work, Christ deemed to be University, Dr. Mary, Assistant Professor of Social Work, Christ deemed to be University, and also the initiator of Youth Voice for Life Even After Death Club. Respected faculties of our university and esteemed dignitaries from the medical fraternity, Columbia Asia and Vikram Hospital, Ms. Renuka and all the group members who made efforts to organize the event today, as well as our keen participants.
A warm welcome is something which brings a feeling of togetherness and kinship. I now invite Dr. Mary, Assistant Professor of Social Work, Christ deemed to be University, to address the gathering. Welcome, ma'am.
A very good evening to one and all present here, and thank you to the student coordinators for their lovely introduction and for highlighting the need and objectives of the event sincerely. The idea of forming the Youth Voice for Life Even After Death Club, that is YV4Lead Club, stemmed from an awareness activity conducted at Christ main campus. Since its inception, we have made several efforts to empower students and the general public with adequate knowledge about the importance of organ donation and to educate them about their role and responsibilities in spreading awareness across. Well, Christ University has always been sensitive towards diverse social causes and has come forward to bring social and appropriate behavioral change. Indeed, I'm very delighted that this year we have experts from the field of organ transplant with diverse specializations. The session will give the participants an opportunity to gain insight directly from the experts to understand the value of organ donation in the life of an individual and about the growing burden of not finding a donor for years. As a social professional, as a social work professional, I believe social workers can be important actors in removing barriers at the grassroots level, as well as in sensitizing the public at the larger scale. I hope the knowledge that our participants gather today will help them gain better insight and which in turn helps them to take the right decision at the right time. I would now like to invite Dr. Victor Paul, our Honorable Head of the Department, Sociology and Social Work, Christ deemed to be University, to enlighten the event with his wise words.
Yeah, thank you. Thank you, Professor Mary. I hope I am audible.
Yes, sir. Yes, sir.
Thank you. Respected guests, faculty members, and dear students. Let me thank Youth Voice for Life Club, our department's club, which is initiated by Professor Mary, and all the students, service learning students who are part of this event, who have organized this event. Every year, our service learning club organizes this program. As you know, August 13th is observed as World Organ Donation Day, which is aimed at raising awareness about the importance of organ donation and encourage people to take a pledge for the same. So this day, people across the globe strives to people in realizing that volunteering to donate their organs after death can be life-changing for many people. This can be done by any age group, and you can donate organs to people in need at any time. So in case of a donor is under 18 years, they are also required to have consent. With the consent of parents or adult guardians, they can register themselves for organ donor as an organ donor. Chandana mentioned about some statistics. It's very serious figures that you have heard. About 500,000 people die because of non-availability of organs. That could have been prevented by organ transplants and that were not available to them. Approximately about 200,000 people died due to liver disease and another 50,000 approximately due to heart diseases. Moreover, 150,000 people await kidney transplantation, but only 5,000 get among them in India. If you look at organ donation rate in India, it is very minimum, 0.01%. A minuscule figure in comparison to some countries like Croatia, which sits at 36.5%. And Spain, if you see, 35.3%. We have an act. India, we have Transplantation of Human Organs and Tissues Act. We call it THO Act, mainly to regulate organ donation in the country. Same time to facilitate. So, as per the law, both deceased and the living people can donate their organs. We have experts here today. I think we will listen to them, their live experiences about organ donation. According to WHO, This organ donation, WHO is facilitating through various mechanisms through our countries. So people of any age group can donate organ, and the oldest known donor has been in Scotland, where a 107-year-old woman donated cornea after her death in 2016. Also, the oldest known organ donor for an internal organ was 95-year-old West Virginia man who donated his liver after he died. So people of any age can donate organ. And we, in our country, we have hospitals which is equipped with all facilities to facilitate this process. And we have Manipal group who approached us. For the last 2 years, we have been conducting this program with their support. And this year we have Columbia Asia Hospital and Vikram Hospital specialists are with us today. So students, the organ donor can play a very big role in saving others' life. Students like you can play a greater role in sensitizing people about organ donation. I congratulate and thank Professor Mary and the students who are part of this service learning program for organizing this event, and all the participants for taking time to be part of this. So on behalf of the university and the department, let me thank all the doctors and experts who are present here for creating awareness among our students and educate our students about organ donation. Thank you. Thank you very much.
Thank you, ma'am. Thank you, sir, for your enlightening words, which are always inspiring and help us move forward with great enthusiasm.
Moving forward, we have Ms. Renuka Nilgandan from Manipal Hospital, Oriyapur Road, who will be introducing our esteemed guest panelist and resource person who would educate us further on the reason for our gathering, which is organ donation.
Thank you so much, Dr. Paul, for your insight, and thank you, Chandana, for introducing me. I'd like to take this opportunity to introduce our doctors in the panel today. Dr. Deepak, nephrologist and transplant physician at Columbia Asia Referral Hospitals, Yashwantpur. Dr. Girish Yanas, nephrologist and transplant physician at Columbia Asia Hospitals, Hebal. Dr. Manohar T, urologist and transplant surgeon at Columbia Asia Hospital, Whitefield. Dr. Manohar Badrappa, urologist and transplant surgeon at Columbia Asia Hospitals, again, Sajapur. Dr. Partha Shetty, a transplant nephrologist at Vikram Hospitals, Bangalore. Thank you all for joining us today. And over to you, Dr. Deepak.
Well, thank you for inviting me to share views on organ donation. Good evening to all my dear friends from Christ University. On the eve of organ donation, today let us have some basic insights about this organ donation. Now there is a saying that, soul goes into heaven and not the organs, and we have to bury them here. So let's make everyone aware that we don't bury the organs, and instead of that we can save certain lives, that would bring a lot of joy to the suffering people. And moving about the organ donation as such, organ donation is a process wherein the organ is donated from a donor to the recipient. It could be any organ like liver, kidney, heart, pancreas, lungs, eyes, and so on. So what are the types of organ donation we have? We have two types of organ donation. One is the live donation. The other one is the cadaveric organ donation. Now, live donation is the most commonly performed organ donation all over the world. Cadaveric or the deceased organ donation is other type of organ donation which happens less commonly, particularly in India. It happens very, very less commonly. Live organ donation happens when there is somebody living and willing to donate organ to the needy recipient. And usually it happens between the relatives, so it is called live related organ donation. Whereas the deceased or the cadaveric organ donation happens whenever a brain dead person who was willing to donate his organ before his death, or the family gives consent after his death to donate the organs, and that those organs are transplanted to the needy recipient. Now, compared to live donation, the advantages of deceased organ donation are you can have much more organs which can be donated to the needy recipient. For example, in live donation, we have only liver or kidney which can be donated. But in cadaveric or the deceased donor donations, you can have liver, heart, lungs, kidneys, pancreas, and the cornea which can be donated. So you have a lot more organs which will reach the needy recipients. And the second thing is these organs would be wasted if they are not donated. And that carries an importance. And the third thing, over a period of time, over last 20-30 years, the options of living donor are coming down because of the fact that we are moving into nuclear families. You don't have much people in the family, as well as incidence of diabetes and hypertension are on the rise. So limiting the options for living donation. And hence, moving forward, cadaveric donations are the state of art, which is being established particularly in Western countries, wherein previously it was mentioned by Dr. Victor that in Europe and in US there is a lot of cadaveric transplantation which happens. In India, you have only 0.8 donations per million population as of now. This is the present statistics, as compared to US or Europe, which have about 25 and 30, and Spain is the highest with 36. Such a vast population, we can negate the effect of living organ donation, in the sense we probably might not need anyone living to donate their organs if we utilize even a small part of deceased donor program. So with this introduction, I'd like to thank and move forward with the further speakers. Thank you.
Thank you so much, Doctor, for setting the stage and giving a very brief, good introduction about organ donation. Next on the panel, we have Dr. Girish, who would be sharing his views with us. Over to you, Doctor.
Good evening, everybody. Am I audible and visible to all of you?
Yes.
You are audible and visible.
So, yeah, thank you all for attending this webinar. As we know, as we heard from the previous speakers, there is a clear deficiency of donors. So there is a gross discrepancy between the demand and supply. If you ask me, it's about almost a 400 times requirement as to what we are supplying. So the number of transplants that are happening in India is only 5,000 to 6,000 per year, as opposed to the probable need of 2 lakh organs per year. So I'm going to touch upon how we can expand the donor pool. So there has been a number of attempts since the first successful transplant in the world, 1954, that was for which Dr. Joseph Murray got a Nobel Prize. And in India, I think the first successful kidney transplant was in 1971 at CMC Vellore. Since then, there has been a number of attempts to expand the donor pool. This can be divided into two aspects: expanding the living donor pool and expanding the cadaveric donor pool. So if you're looking at expanding the living donor pool, number of barriers have been crossed over years. Earlier, maybe about 15-20 years ago, when somebody came with different blood groups, let's say A to B, willing to donate, we would turn off the couple, saying that no, your blood group is different, we can't. But nowadays we have crossed that barrier. So we are starting to do a lot of ABO incompatible transplants. So essentially, the donor doesn't get wasted, and at the same time, there are a number of studies to ensure that this is a safe process. Okay. Now the next step of expanding the donor pool. So whatever reason, when we cannot do the blood group across the blood group transplants, few other ways of expanding it is to consider swap donation, meaning to say a paired donation. So we have got an incompatible couple A, B on one side and an incompatible couple C, D on the other side. So A will donate to D and C will donate to B. So that has been very successfully done, especially at our centers, and we are gradually on the rise. Now that is one pair, that's called a swap donation. But when you put such hundreds of incompatible couples together and try to form a chain, it is called domino. And we have to take some lessons from the West, where they're doing almost 30 to 40 transplants with these pairs. And this is one of the few ways when we can expand the donor pool in living organ donations. In terms of cadaveric donations, what we have done is we have, over a period of time, extended the criteria required for donation, such as older donors, patients with diabetes, patients with certain types of illnesses, and this is all being tested and the safety established by various studies. One other interesting concept I would like to touch upon in cadaveric donations is the concept of brainstem death and cardiac death. So as my earlier speaker alluded to the fact that brainstem death donors are mainly being considered in India, West is sort of leaders in the cadaveric donation. West now have completely moved on from brainstem death to cardiac death. So brainstem death is when your heart is still beating and lungs are being supported by ventilator, and there's no connection between brain and the rest of your system. Whereas cardiac death is when the heart stops. That's a real challenge, but that again has, we are probably 10-15 years behind the West in terms of catching up these things. But predominantly 70 to 80% of the donors in the West are DCDs, that is donation after cardiac death. So it's time that we really step up our gears, move on, and try and focus on improving the organ donation rates in India. And hopefully, not only in Olympics, we should also get a medal in organ donation, hopefully in the next few years to come, and by saving many more lives. Okay, with this, I would like to thank you for the opportunity.
Thank you so much, Doctor, for enlightening us with your words. It's true that it is a need of the hour, and with a lot of technological advancement, I hope we reach that place. One reminder to all the doctors and our esteemed panelists to stick to the time limit, because we'll have a quick Q&A session as well towards the end. So thank you so much again, Doctor. Moving on, we have Dr. Partha, who will now share his knowledge with us. Welcome, Doctor.
Hi there, can you all hear me? Thank you, Christ College, for this opportunity. I'll ask a couple of common questions which they ask me for transplantation. These questions include: who can be a donor in the living scenario? Who cannot be a donor? What is the maximal age for donation? And how is life for a donor after transplantation? So the first thing is, anybody who's above 18 years of age, who's living, and who's below 18, who is deceased unfortunately, could be a donor. Above 18 years of age is for the living criteria, because below 18, the woman mentally competent to donate an organ. Upper limit of age is very variable, like Dr. Paul told us a little while earlier. For the living donors, it's approximately 65 years, if you take a broad number. But there have been instances where there have been people who are about 70 years and above also, depending upon the scenario. There are certain conditions where we cannot accept an organ. That is, people who are below 18 years of age, who are too young to decide about donation. Then people who have got an active psychiatric illness and who aren't mentally competent to face the consequences of donation and make a decision. Apart from that, people having active infections that could transmit them to the recipient. People who are having an active tumor or malignancy, because it's been known in some rare cases that they can transmit tumors across to the recipients also, and people who are diabetic. Now, diabetic is a bit of an interesting aspect here, because of late, people who are very fit diabetics and who are very precious recipients are allowed. But in general, diabetics are not accepted because they themselves could be at risk of having kidney problems in the future. And that's because that's the most common cause of kidney failure in the world today. Apart from this, another very important aspect is the financial transaction, which I must mention. It is a complete no-no if we know of anybody accepting money or a financial transaction, or if the donor is being forced or coerced into donation. Such thing is extremely unethical and not allowed. Regarding the points after donation, so donors who donate their organs are usually pristine when they are accepted to be donors. Anybody who's not well, having a major disease, or who will be at risk later will not be taken as a donor in the first place. So I always reassure them that they have a normal lifespan, they can perform normal physical activities, normal reproduction, and we'll be monitoring them once a year as nephrologists. That's more of a moral duty to make sure that they remain to be fit after giving a kidney. For the recipient, it's definitely a big advantage because in terms of kidney, at least they're free from dialysis and they can make a living. Most importantly, they can live long because the lifespan expected after giving a kidney is much, much longer than that of being on dialysis. So with that, I will stop talking about the pros and cons of donation and go to the program. Thank you so much.
Thank you so much, Doctor. It was extremely informative about who can donate, who cannot. I think it's very essential to know. Thank you so much again. We now have with us Dr. Manohar Bhadrappa, who will be sharing his knowledge on the topic. Welcome, Doctor. Do we have Dr. Manohar? Dr.
Hello.
Manohar?
Yeah, can you hear me?
Yes, Doctor. Yeah.
Yeah. Okay. Good evening, everybody. I once again thank the Chakrayast University for allowing me to give me opportunity to talk about donor organ donation. So I'll stick to my questions. That's how to pledge your organs. The first thing is that it's very simple. So there is you can register online, either in Bone Foundation or ZCCK. So where you can just register yourself, and they, in Mohan Foundation they will give an online card, and in case of this ZCCK they will give a card. You can carry it in your wallet or something, so that they'll get to know that you have pledged your organ. So that is one way. Only thing is that if you are 18 years or younger, the parents or the guardian should give a consent to pledge your organ. Otherwise, if you are 18 and above, you can pledge by your own. So another one thing is awareness on brain dead patients and the fear among people, why there is limit for a transplant. This is the next question what I'm supposed to answer. So what I say is donating the organs, that is the best gift what you can do, donate to the society. So what I say that if there is an opportunity to donate, I think so you should donate the organ of the dead. After that, so they say that immortal can be immortal for lifelong. That's what they claim. So why there is urgency in after brain death? See, there is something called as ischemic time for every organ. For example, cardiac and lung will have a ischemia time of around 4 hours. And coming to the pancreas and liver is around 11 to 12 hours. And coming to the kidney for about 24 hours. So what is this ischemic time? So the time limit from the time you take the organ from the cadaver to transplanting into the recipient is a ischemic time. So that is the most critical thing why we have to concentrate on this. So that is the reason why this I think so you would have heard about this green corridors, what we hear done on the roads. So this is just to save the time, so that the earlier you transplant in a recipient, the better the outcome will be. That's all is the reason why we have to shift the transplant the organ at the earliest. And So yeah, I think so that we have to concentrate more on this. So I was also discussed about that how they do about this cadaveric transplant. Once in India, as Dr. Girish has told, they consider this cadaveric organ transplantation only in cases of brain dead patients. I think so we should also shift over to like concentrate on cardiac death patients also. What they do is once the patient is considered as a brain dead, so what they once we register, we call the first 5 registered patients for the cross matching. Then we cross tally the things. Then with the recipient as well as the donor. Then what we do is once everything is ready, the patient, when we get to know that which patient is getting which organ, based on that we start retrieving the organs. And then at the place where the retrieval is done from that hospital, to the hospital we have to send also, that we will make way a proper way. That's a green code what we make. So this all because of to save the timing between the retrieval and the transplantation time. So this is all basically due to if you transplant the organs at the earliest, that's the best outcome you can have. I think so. If anything is there to discuss, I think so. I think so. I will answer in question answers. I think so.
Yes, doctor. So we have a few questions, and we will address them in the Q&A session. So thank you so much, doctor. That was very informative. And we would now like to invite our final speaker for this session, Dr. Manohar T. Sir. So over to you, sir. Doctor, you're muted.
Yeah, thanks for the invite, and I appreciate and I'm indebted for all the speakers here and also the student community. And it's very nice to see the whole student community and the colleges doing this phenomenal awareness program. So the nephrologists and all the other people have mentioned regarding the gravity of the situation and where should be the donor awareness should be given. So what is the surgeon's role? What I'm going to do it? What is the surgeon's role in improving the donation? So I think we know the statistics is going on, talking about the Spain is the highest. There are 36 PMP per million population. Come to the second is USA, and then in India, the scenario is we know that both the living and cadaver included is 10. That's up to 2019. I mean, after the COVID, it has dropped down to 50%. So we have about 9.9 PMP. That is the population per million population per year, 10. So there is a gross. But what is the cadaveric? Cadaveric is about 0.8. Now this incidence is about in 2012. It is the total donation, including both cadaver, was about somewhere around 4.5. In 2007, it was 0.1. And now in 2017, it had become 10. What does it mean? It has doubled. From 2012 to 2017, the donation has become doubled. There are various, I know that there is awareness. That is the period where the laparoscopic surgeries came into introduction, wherein the kidney delivery, instead of open nephrectomy, the minimally invasive way of removing the kidneys. So that has prompted a lot of people to take up. Even if I want to tell that in Gujarat, we have made a survey wherein within 5 years, there's a triple amount of the people started donating, because of the why this phenomenon of doubling from, surgical aspect from open to laparoscopy. For example, so this is the incidence where it has been doubled. What is the reason for these things? Yeah, surgery, of course, when you do an open surgery, there is involvement of the rib cutting, where you have to have a 12th rib cut, and you have to cut the muscle, and then you have to retrieve the kidney. This is the normal phenomenon of live donation. So what does this minimally invasive surgery does? It's a laparoscopic procedure wherein the patient is put in a lateral position and they put a gas inside the abdomen, make 3 small holes, and the kidney is not been touched anywhere. Directly it will graft the complete kidney can be dissected out, and then remove the kidney in a very small incision. We call it as a very small flank incision For a girl, we call it as a bikini incision. So this incision is about 6 centimeter incision, muscle splitting. So what are the advantages of this? The patient stay in the hospital reduced by 60%. Instead of 6 days, it has become 2 days. The pain score has reduced from 9 to 2 as far as compared to the open surgery. And then lots of days. The patient who had undergone open surgery would have stayed in the house, thinking that pain here, pain there for about 3 months, which is not the scenario. Within 3 weeks, the donor is going for work. So loss of hours, loss of the pay, the hours of duration in the stay. So everything has come down. And moreover, surgically, the blood loss has come down to nil as compared to 500 to 150 to 550 ml in case of open surgery. So there is a big advantage of a surgical role in promoting donation for this kind of situation. So I would like to tell 2 things here as a surgical role. For a cadaver donation, I think the awareness is very, very important. Awareness to all the public, and whatever you are doing is ideally right for that. And cadaveric donation has to be, awareness has to be created. It has to be throughout the day for a year. I don't think it can stop on this 13th of this particular day on a Friday. And what about the living donation? We are involved into that. We should treat them, every donor, as I was mentioning today, the program was there, we treat our patients as gods, but then the donor is a super god. So each and every donor should be promoted. He should be made a superhero so that we can talk about here. Do you think the donor will come? No. Each donor should be caught hold of, and he should be made a superhero so that he will bring another 10 patients, another 10 donors. He is the best marketing tool for this organ donation. With these words, I'm going to stop it here. Thank you.
Thank you. Thank you so much, Doctor. It was such an informative session with all the doctors, and to get insight from within the medical fraternity as to how surgical advancements have been there. And I think these awareness sessions are so important to bring up more donors who can, as I also mentioned, my first slogan was save life after life. So thank you so much, Doctor. It was great. It was such an informative and insightful session. I thank you all for your valuable time. Moving on without much delay, let's head on to the last leg of our webinar. We are now opening the forum for a Q&A session. So prior to the commencement of this webinar, we asked the students to send questions they would want to ask our panelists. So we have collated these questions, and we will be asking these set of questions to our doctors. If we have time, we will definitely open our panel for questions from participants live, and participants can post their questions on the chat box and we will address them. If we do not have time, you can still contact the coordinators and mail them. We'll make sure we ask the questions to the doctors and give you the answers. So let's move on to the questions that we already have, which we have received from the Google Forms. So our first set of questions is to Dr. Manohar Bhadrappa. So Doctor, my question to you, these are all from the Google Forms, would be, what are the measures which are taken when the donated organ is stored? And continuing that, I would also like you to answer that how is a brain dead person actually declared brain dead? Like, what are the things that you take note of when you declare a person brain dead? So these are the 2 questions I would like you to answer, Dr. Manohar.
Okay, so what is meant by brain dead is the brain, except the brain, all other organs are functioning in the body. Means to say that, so the brain is destroyed either by stroke or by any head injury. All these things can cause the brain not to function. But rest, brain and brainstem are the ones which we consider, if there is distraction of these 2 things, we consider as a brain dead. So there will be 4 committee people in every hospital which is registered for cadaveric, and they will be declaring dead, brain dead in a patient who has been decided that looking at the condition of the patient, who is treating physician of that patient, well, once he thinks that the patient will not be able to survive. If we took him out of the ventilator, if we take him out of the ventilator, then we consider him as a brain dead. So there are a series of tests something called as, there are twice it will be done, that is apnea test will be done twice in that patient. That is, what you mean by is, you do the cortical functions, there is a brainstem reflexes, all these things are there in a, to declare that a patient is brain dead or what. So in this, the treating physician as well as the neurologist and one more intensivist will be looking into that, looking for the reflexes in that patient. And once these are negative, they will be considered the patient as brain dead and he is fit for the organ donation. This is what is the thing.
Thank you, doctor. Thank you so much. Yeah, moving on. Next question will be asked by my fellow coordinator, Chandana. Chandana, are you there? So,
excuse me for my network, sorry. Yes, so thank you, sir, for addressing the question. So the next set of question is for Dr. Partha. So, sir, the question which is there for you are, what is the age limit for organ donation and who can become a donor? And what are the medical conditions that make an individual ineligible for organ donation?
So for organ donation, like I told you before, above 18 years is required for a living donor. Because below 18, you won't be mentally competent to make a decision. It's a big call to make. The other thing is that age limit-wise, it's usually about 65 years of age. It's very variable depending upon how fit the donor is and what the center's rules are. But 65 is probably a good number where most people would be rejected beyond that. Medical conditions like diabetes, we don't prefer taking donors because they themselves could end up having kidney issues in the future with only half their normal kidney function. Apart from that, people who are having a psychiatric illness, people who are mentally incompetent, they are today. And also people who are having an active infection or people who are having an active tumor or undergoing chemotherapy, when they can still transfer the tumor across to their recipient. So such people are usually not taken as suitable donors.
Thank you, doctor. Thank you so
Thank
much
you.
for addressing the question. Next question or next set of questions would be from Dr. Manohar T. Sir. So, sir, the questions that we have received are, how is an organ from a cadaver or deceased donor transplanted? And what are the health issues which accompany an organ donor? Are there any serious health issues which, because there are a lot of misconceptions regarding the health issues which follow after an organ donation. So, sir, I would like to address this question. Dr. Manohar T. Sir.
Yeah, the organ donation and the living donation, when they donate the organs, they are in a health, number one. We are not going to take the organ from any unhealthy person. So usually the organ is taken from a healthy person. And of course, in this case scenario, it is living donation is being more than 18 years and less than 65 years. But there is expanded criteria of more than 65 years if they are not having any major illness. So we are taking a normal person, we assess them as a normal person, all the parameters, and in general, as a rule of thumb, the whole body hemostasis and the functional status has been checked, and then only organ has been taken out. So in reality, the person who donated the kidney should not suffer any major medical illness in future. That is the bottom line, because it's in general, you should not have to have any problem. But then what is required is anybody can get a disease. Even if you have the two kidneys, you can get the disease. But then when you have dealing with a single kidney, you should be aware there are certain precautions. The dietary habits, good dietary habits, of course, it applies to everybody. Same thing, the general condition. Today's scenario is we are into the junk food, we are into a lot of food fatism. So all those things has to be restricted. The food and the restriction of the salt, restriction of the sugar, not only salt, restriction of the sugar. So it should be having a normal, very good lifestyle, plus a very good exercise. these are very important for him to lead a good, healthy life after donating the organ. That's the second part of the question. So he is not going to suffer from any of the major illness, but he should take care of himself. If he donated it, so he should take care of himself better. In fact, they are taking care of more because they have donated rather than the other people who are living with the 2 kidneys. The paradox is that. So now the second part is how it has been transported from one place to the disease donor. Yeah, there is certain solutions are there. And of course, basically, one should understand that any organ has to be cooled for it to get lag. The cells, the cellular level, at the cellular level, the cell has to be active when you start perfusing. It should be at the between the 0 to 5 degrees centigrade. So what is the best solution? I mean, we cannot. There are so many things, how to transmit and all those things. But the simple ice is sufficient enough to put that and to put the kidney. And then there are a lot of solutions are there. How to perfuse all those things while retrieving the kidney itself. There are a lot of solutions. There are HK solution, the urocolin solutions. I mean, there's not the idea of to go into the details of that, but then these solutions and the ice makes the kidney viable till it is transplanted into the kidney up to 36 hours. Earlier they have said that 24 to 36 hours. So it has to be transported in a conducive manner, in a proper setup, in a proper box. There will be 3 layers of packing will be there, and then it has to be kept in a ice box, and then it's to be cooled at a particular temperature, and it has to be transmitted to the table where the cadaver is ready, and then everything is fine, and then we expose it to the warm ischemia. This is how it has to be done. Hope I am clear about both the answers.
Yes, sir. Thank you so much for giving us such a detailed explanation to it. Hope we could enlighten ourselves by your explanation. So the next set of question is for Dr. Girish, sir. So, sir, the question for you are, what are the criteria that makes a person eligible for donating organs? Also, what are the risk factors of organ donation?
Okay, I think some of the points that I was going to tell has already been answered by certain speakers, but never mind, I can reiterate that. See, the eligibility criteria for living and cadaver is slightly different. For the living donations, we look for healthy individuals, and when we are donating, the principles on which we work is that first of all, they should come voluntarily. There should be no force. So from a mental health point of view, they should be fit, and they should come forward and donate it. There should be whatsoever no pressure at all. So that's one of the most important criteria that I look into. And because quite often in a country like India, there's always that family pressure and stuff, which all this should be sort of worked into. Coming to the medical aspects, when I look into the disease of the donor or the conditions that the donor might develop, my focus is that, see, at the age of let's say 80 or 90, he should still be alive and free of dialysis. That's the whole point. When you donate an organ like a kidney, you don't want to end up in a situation where the donor ends up requiring kidney himself. So which is where I think all the medical tests and the criterias that we design should be targeted at long-term outcomes to ensure the safety of the donor. Coming to the cadaver donation, we have crossed a lot of barriers in terms of how we can sort of extract a cadaver and stuff. So the criterias are no active infection. If I come to know that a cadaver has an active infection, then it is definitely not good to put that kidney in the recipient. And secondly, presence of any conditions such as cancerous. I think the topic of diabetes is subject to debate because there are centers in India which have started taking borderline diabetic and in fact, frankly, diabetic kidneys, both in the living as well as in the cadaver donations, but under specific circumstances wherein these few points I told you earlier are met. In terms of coming to the second question, the risks that are involved, again, I'll divide it into living and cadaver for the recipient, obviously. So for the living person, when somebody donates a kidney, there's usually some of the studies done about 10-15 years ago showed that if you donate a kidney, actually you're going to live longer than a person who doesn't donate. The reason why is probably when you try to donate a kidney or an organ, you get a full thorough medical check, and after donating an organ, you look after yourself well. So which in normal circumstances one would probably ignore, given the current the treadmill we are in terms of the workload, work stress, etc. So I think that is one thing one has to look at. So in fact, but there are certain studies which has reported that if you donate, like for example, a kidney, there is a small risk of high blood pressure. However, overall it is a safe process. That's what I would like to ensure all of you. In terms of cadaver, there are when a cadaver kidney is put into the recipient, it may not be as good as a living kidney, but it really depends on what is the age of the cadaver, what is the age of the what are the comorbidities that the person and what circumstances the kidney has been sort of donated, and how well the kidney adjusts to the body of the recipient. But these are all risks that can be mitigated easily with the current set of medications and the technology we have. So I would say that if you look at the overall benefit versus risks, it's always the benefit that should and will shine through. So I hope this answers you, cover your 2 questions.
Thank
Thank
you,
you
sir,
so
for
much.
giving us such a detailed explanation and interesting facts also we got to know.
Thank you so much again, Doctor. Yes, we are so glad that all our doctors are such experts. They give us such detailed explanations. We're so glad that we have experts among us. So the final question that we would like to ask is for Dr. Deepak Chitrali. So Doctor, the question that I would like to ask is, how can we ensure that the organ being donated is used for human welfare and not otherwise?
Okay, well, you have asked a little controversial question there, but nevertheless, it's always used for human welfare, and it goes to the patient who deserves it. Okay, so again, you have 2 things here. One is living, and other one is cadaveric or the deceased donor organ transplant. In a donor transplant, you have a donor and you have a recipient who are related. That's why most of the times it is stressed upon related transplants, wherein the idea is to have a good transplant donation and not involve the commercial aspects there. So that goes well with a living donor transplant, and it is done after thorough checkup. All the testings are done. The recipient is prepared with immunosuppression, that is medications before the transplant. It goes through the process of legal committee, which clears the organ donation, and with all the medical tests, then the transplant happens. So it goes through a lot of steps wherein all these legal things are taken care of. So that is about the live transplant. When it comes to deceased or a cadaveric transplant, it's usually anonymous, in the sense whoever donates will not know where the organ has gone. But again, it goes through a stringent process wherein there is a body called Jiva Sarthakate in Karnataka. Each state has its own central organization of the body, which controls the organ transplant all across the state. And the people get registered. I mean, the recipients who are in need of transplant get registered through Jivana Sarthakate based on the date of registration and the blood group and the fitness levels, what they are for transplant. This kidneys or liver will be allotted to them. Again, as I told, it goes through a stringent process, and it is very transparent system. And again, as I told, it needs a lot of preparation from the patient as well as the doctor's perspective as well to do this transplant. So it's a completely transparent process which happens, and I think we should all be happy. But we keep hearing those news elsewhere. Sometimes there was this financials involved or money involved. I'm not telling anything towards it or this thing, but we keep hearing that. But at the end of the day, I think 99% it is a transparent process. Thank you.
Thank you so much, doctors, for taking time and answering all our questions. I think we don't have much time, but we have one question in the chat box, and if quickly I could read it. It's from Haranyu. So Haranyu asks, Doctor, could you please let us know the organizations where one can register as a donor? So if I know we're almost at the end, but if one of our panelists could answer the question quickly.
So shall I take the question if others have no objection? So basically, it's a very easy process. No, Jeevasarthakate is one of the websites. They're renamed as SOTO, that is State Organ and Tissue Transplant Organization. So there's a NOTO, ROTO, SOTO. At national level, there is NOTO. Regional level, there is ROTO, and state level, there is SOTO. You can visit any of the websites, either NOTO or SOTO, and you can download the form and basically register. It is as easy as just scanning with your if you have a QR code or a barcode, just need to scan and it get registered. Yes, registration is very important, but also it's important that you need to tell your family members that you're registering, because at the end of the day, when God forbid if things happen, it's the family consent that is very important in organ donation process. So registration is a very simple process, but informing your next of kin and family members is equally important.
Thank you, Doctor.
Thank you so much, sir, for taking the question. And indeed, it was very informative, sir.
So much, doctors. It was indeed.
Studies, one last thing. Manipal also has a provision to register, and today we are kind of releasing that, a microsite. Probably I will just share that with you. So as doctor said, we have embedded all the details on that microsite. It would be of great help if you can, cascade this information to your students, and that would be helpful. Thank you so much.
Sure, ma'am. Yes, that would be great. Thank you so much. So we are almost at the end of our session, and I would just like to thank all our doctors once again. Gratitude is not only the greatest of virtues, but the parent of all others. In accordance with this great quote by Marcus Tullius Cicero, I would now request Ms. Renuka to present the meeting.
Thank you so much, Karis. It was such an insightful session. I'd like to thank the faculty from the Christ University, Dr. Mary, Dr. Paul, Karis, Chandana, Parnika for supporting the cause and also collaborating with us, and the doctors from Columbia Asia Hospitals, Vikram Hospitals for giving us the knowledge and helping us to deep dive into everything about organ transplant. Thank you so much. Over to you, Karis, again.
We now invite Parnika Rastogi, who will present a token of gratitude on behalf of Youth Voice for Life Even After Death Club. Over to you, Parnika.
Thank you, Chandana. It's an honor to have been asked to offer a vote of thanks on the occasion of Organ Donation Day on behalf of Youth Voice for Life Even After Death Club. I would like to express my sincere gratitude to our Honorable HOD, Dr. Victor Paul, sir, for his constant encouragement and guidance, Dr. Mary ma'am for her tireless efforts to organize the event successfully, Dr. Shija ma'am for her unconditional support at each and every step, as well as all our respected faculty members of the Department of Sociology and Social Work for their presence. I would also like to mention about the additional support we have received from the system admin and the Center for Concept Design of Christ Deemed to be University. We are fortunate to have been able to collaborate with Manipal Hospitals, Bangalore. The constant communication and support of the entire team have made this event a success. Hearty gratitude to all the specialists for sharing their graceful words with us today. Lastly, I am thankful to all the participants for attending the event and sharing the valuable feedback. Thank you all. I request all the participants to please fill the feedback form given in the chat box. Over to you, Karis.
Thank you so much, Parnika. We are almost at the end of our session, and I would like to request all our participants, our respected panelists, respected HOD, our faculty, and everybody to turn on their videos so that we can take a snapshot. Thank you. Thank you so much. I can see videos turning. Thank you, everyone. So, yes, I will now take a screenshot. Thank you so much. So much. Thank you all for joining us today. We hope that with the knowledge and awareness acquired today, we pledge to be organ donors and save life after life. And before ending the session, I would also like to request everybody to kindly fill the feedback form. It would be really beneficial to us in making sure that you have understood, and we would appreciate your valuable feedback. Thank you so much.
Thank you, everyone, and have a great day ahead.
Thank you.